Hello, good evening. Assalamu alaikum. How's everyone? How are you doing? Hello, am I audible, guys?
Yes, ma'am.
Okay, fine. So is voice clear? Okay. So how's everyone doing? So I can see Tayyaba, one Samsung, Iman, Dipti. How are you guys doing? Because we are in, I think, final phase of preparation for November exam. So I'm sure all of you guys are studying and practicing with full swing. So how's everyone? How's everything going? Mm-hmm. All right. Great, Dipti, great. So would you like to present in today's session? Hmm? Who is going to volunteer and who is going to present? Let's finalize. So at least we will have the station practice. So I can see that Tayyiba, are you going for this exam? Hmm?
Yes, ma'am.
Okay, fine. So would you like to present, sweetheart?
Not the first case.
Okay. Then the second case, no problem, no problem. Okay. Okay. I'm traveling. Okay, no problem, Dipti, no problem. Okay. So whenever anybody is comfortable, so can present. Otherwise, I will just try to do it myself and give you the overview that how it is going to be. Okay. Okay, so to begin with, I know that, I mean, these are the last final 2 weeks just before exam. If I'm not wrong, exam is going to be started on 11th of this November, right? So till I think 11th, we have exactly 2 weeks. So that then, the question arises, how are you going to utilize last 15 days or, the 2 weeks before exam? This is very crucial. This is very imperative to know as well that how are you going to, I must say that behave in these 2 weeks, right? So let's discuss how are you going to utilize these 2 weeks before exam? What are going to be the tips and tricks to crack this exam? Because this exam is moreover, the exam of your knowledge coupled with communication skills. Okay. So we need to be very mindful when we are going to practice. Of course, you guys are practicing, and in the last days, what you need to do, this is very important because every day I get messages that we are getting stressed and we cannot the kind of study or we cannot the focus. So I mean it really the gets on your nerves just right before exam. But the thing is, you have come this far, right? You have come this far, so you are not going to just leave this, or you're not going to just not practice in the end, okay, out of the stress, out of an anxiety, out of whatever it is. So what you need to do is you just need to stay focused. You just need to stay calm. You have studied. You have done almost everything. Okay, in the previous, the say 3 months, 4 months, 5 months, whatever you have done. So you have studied. You have practiced. So in the last the few days, what you need to do is you just need to prioritize what you are going to do. What are the exam essentials right before exam? Okay, so we are going to talk about that and then we are going to see how we proceed with the workstation practice. So I'm sure all of you guys know that you are going for MRCOG, the MRCOG, the exam pattern is OSCE. We are going to be having 14 stations. Out of them, the some of them are going to be the simulated patient task and the others are going to be the structured discussion task, right? So simulated patient task, if we talk about, so then you are going to be having the simulated patient task with lay examiner. So if I talk about that, what exactly the lay examiner is going to judge you on the basis of your communication, on the basis of your language. And language doesn't mean spoken language. It has to be your, the body language as well, your facial expressions, your choice of words, your, the pace as well. your, the empathy, your sympathy, what exactly do you, the say, or how do you communicate at that time? That is very important. Okay, so when do you see that you are entering into the cubicle and you see the three people inside? So always expect one of them is going to be the lay examiner. And lay examiners are not doctors, they are non-doctors. They either are going to be teachers, lawyers, the HR, or, they can be any of them, but not the related to any healthcare professionals. Okay, so what will happen is that this lay examiner task is going to carry, the bit more marks than the usual, the task. Otherwise, in the, the briefing before exam, what do they say is in the exam that almost every station carry equal marks. Okay, so I mean, it is the wise to say that you're not going to just the thinking of that, okay, structured discussion task has more marks or simulated patient task has more marks, because what a terrible mistake one candidate do in this part 3 exam is they are just focusing on simulated patient task all the time, and they are not they paying any attention or say less attention to structured discussion task. Let me tell you that simulated patient task and ST task, they both carry equal marks. And what is the beauty of structured discussion task? If you have read your, the syllabus well, if you have revised your important guidelines and talks very well, so what can happen is that you can score, the good in the structured discussion task. So what will happen? That it will add up in your, the final score sheet. So I would suggest that everybody has to revise, the important guidelines. In terms of important guidelines, the guidelines which has recently been revised, they are very important. And many a times what happens is that RCOG brings those stations which has, the more clinical as well as theoretical part. For example, hyperemesis gravidarum, for example, twin pregnancy, for example, the ovarian hyperstimulation syndrome, right? So we know that on all of these topics, we do have guidelines, right? And then comes important talk articles as well. So, the many talk articles are very much important, okay? So try revising your, the stuff as well, because simulated patient task, even if they talk about, so in terms of, the applied clinical knowledge, you have to bring that knowledge into that simulated patient task as well. All right. So having said that, the all stations are going to carry equal marks, number one. Secondly, lay examiner, the perhaps are going to be having either division of the marks or either, the more marks. This nobody knows, but still you have to keep into your mind. So out of 14 stations, in some of the exams, you might get half and half, 7 plus 7, or you might get 6 plus 8. It can be, the either simulated patient task 6 or either 8 ST, 8 simulated patient task and 6 ST. Anything can happen. So plus then comes, the modules. So many modules, they do overlap. For example, antenatal care and maternal medicine, then comes core surgical skills and post-operative care, then comes labor and delivery. Okay, labor module is separate and the delivery module, management of labor and management of delivery and management, postpartum management as well. So what happens is that you might see in one exam 2 stations, maternal medicine disorder, or you might see 1 station. You might see 2 stations related to core surgical skills, okay, post-operative or core surgical skills, or you might not see, the 2 stations. So never think that, they are not going to bring all these topics, but yes, some of the modules can overlap and some of the modules can come, as it is. So be extremely careful that when you are preparing for your exam, when you are, what you can say that making a schedule, right? Because schedule is very important for everything, whatever you do, right? So planning, I must say, plan your, that what are you going to do in this particular day, which module, how many stations, from where you will revise, how you will revise, how many number of stations you will revise. So number of stations, of course, you have to revise, but then it doesn't mean that you are just going to practice, practice, practice. So what are you going to do that? And for me, it's not a wise idea that you just need to practice, the many students, and I think it's a grave mistake. Okay. So don't try to do 14 stations in a go every day. So what will happen is that you are exhausting yourself, you are exhausting your neurons, you are exhausting, I don't know what energies of yourself. Okay. So I think it's not a good idea. So what you can do is either you can do 4 or 5 or say, the 6 stations, but it has to be end to end. Okay. End to end means that you are going to start your station, you are going to revise your guideline or, the TOG article or patient information leaflet at the same time. So this way, what will happen is that you are going to cover your information gathering part coupled with communication. Of course, communication is going to be of two types: communication with patients and relatives, communication with the communication with colleague, right? So if you will be thinking all the time, on all these aspects, trust me, part 3 is going to be a piece of cake for you. Okay, so what exactly is going to be the difficulty for candidates? They are just going to be making the mistake that, okay, no, I just have to speak. I just have to do the simulated patient task. Okay, yes, it is important. And at the same time, another the grave mistake is that you are just going to be thinking all the time that, okay, I have to use the correct use of grammar, the very fancy sentences, very long sentences. Okay, which is good, which is not bad. But the thing is, this exam is not your English language exam. Okay, although it is a foreign language for us, but it's not a language based exam. So you need to speak whatever is important or whatever is required for that desired this station. Okay, so what you need to do is that you have to have a good communication skills. Like I said earlier, communication does not mean, what you speak. Communication has to be from your facial expressions, from your body language, from your tone, from your pace and everything, and, almost all these things. So don't just try to stay focused on your English, okay, all the time, because we as an overseas candidate, of course, we do face a lot of, you can say somewhat difficulty because the English is not our first language. Okay, so don't always try to think of that. No, I just have to bring fancy sentences, then only I can, perform in this station. Okay, so the bringing fancy sentences is not bad either, but the thing is you just have 10 minutes. So you just need to finish everything in 10 minutes time. So you need to calculate your time, that how are you going to divide, how are you going to dig out history, how are you going to bring your patient safety element, how are you going to manage the case as well. All right, so if I say manage the case, then yes, you have to then you have to do what? You have to ask the patient again for any question. You have to close the loop, you have to send the patient to GP or the midwife or whichever referral is it. Okay, so be extremely careful when you are in your exam. Okay, so exam is quite, I'm sure all of you are familiar by now. Okay, so there is going to be 2 minutes reading time outside the cubicle, 10 minutes inside the cubicle, which is performance time. Usually 5 to 6 or 7 to 7 are going to be the structured discussion. The rest are going to be the role players. Out of them, 4 are going to be with the lay examiners. This may carry the highest marks. There is no rest station. There is no break. Total 168 minutes and it's done. Okay. So at the same time, what you need to do is you have to have stamina. You have to have the all energy, physical, psychological, mental, everything. So what you need to do in these 2 weeks, you have to save your energies, right? You don't need to exhaust yourself, you don't need to exhaust your neurons as well, because your the mental health is equally important as well as your physical health, isn't it? So make sure that you are the being easy on yourself. Whatever you have done in the previous the months, okay, utilize it. So in the last few days, in the last 2 weeks, what you exactly need to do is that you just need to plan yourself. Okay, you just need to plan that, okay, on day 1, for example, today is 26th and tomorrow is going to be 27th. So what am I going to do on 27th, then 28th, then 29th, then 30th, and so on and so on. So from this, now you have to plan that how are you going to behave in your exam. Okay, so I'm sure all of you are familiar with this, that this is going to be the exactly exam pattern. This is outside the cubicle, what we commonly called as, you are going to be having 14 station and then you have to move from one station to the other. Okay, so I hope everything is clear so far. Everything is clear?
Yes, ma'am. Yeah.
Okay, brilliant. So what you need to do is that you just need to understand that you have to save your energies at all times. Okay, so you can see that 2 minutes, 2 minutes, and then 10 minutes inside, 10 minutes inside. So what will it will be having? You have to sit, you have to stand, you have to walk, you have to sit, you have to stand, you have to walk, right? And it is going to be coupled with a lot of the mental rehearsal. You have to recall, you have to what you can say, that you have to bring whatever you have done in the previous 5 to 6 months in your preparation. You have to be the best version of yourself in every station, isn't it? So what exactly do you need? You need energy. At the same time, because you are standing here, you can see that everybody is in very the comfortable attire, comfortable shoes. So, do that as well. All right. So don't, for the girls, I must say that, the don't be so fancy or don't be extra fancy on the exam day. We are very comfortable. Okay. Very subtle colors. And those should not be the sharp colors like orange, like green, like shocking pink or purple or whatever. But, you have to have a very professional look. Okay, so you have to have at least the what I would suggest most of the time to my students is that at least wear the neutral colors. Okay, blue, black, off white. So it is good. Don't try to overdo yourself. Okay, don't try to do extra makeup, no jewelry, no watches, no nothing. So just stay as simple as possible. The people who do hijab or niqab, it is always the advisable and important that there should not be so many the tons of pins on your head, and you should not be just fixing your scarf all the time. Okay, so scarf has to be very tidy as well, and even it should be of the very black, blue, of white color, whichever suits. But don't they bring so many colors. So what will happen is that it will be a distraction to the other candidates as well. Plus, this is very important. Shoes. Wear comfortable. Don't buy new shoes, okay? Exclusively for exam, okay? Don't buy, the heels. I would not suggest, even if you are comfortable with heels. So what happens is that if any of you have had, the experience of giving this exam in London, okay, center. So you can see that, there is a wooden flooring, and I'm sure you all have this idea that if you will have, if you will wear heels and you are walking tuck, 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 tuck all the time, so it will make a lot of noise. You will get headache, your peers will get headache, examiners, everybody, you can imagine that, people running back and forth, yeah, with heels and, the lot of noise. So at the same time, while you are taking care of yourself, take care of others as well. Okay, so for the boys, I must say that don't just go with your, the very casual attire. Okay, don't wear jeans or the tees or what you can say, the hoodies or something. But you have to look professional. Okay, so again, the blue, black, white, off white. These colors are very nice, very good, and the wear them, wear comfortable shoes, and then just be the okay. All right. So somebody has asked me that, what about watch? Okay, watch is very good and it's a very good idea. But at the same time, we all have a habit, that after like every few minutes or, the hours, we are going to look at our watch, or we might get, the apprehensive at that time. Okay, or we might get anxious. So don't be upset about it. Okay, in RCOG exams, you are going to be having 2 minutes, a very nasty ring, and then after 2 minutes will pass, you will have another, the sound of the ring. You will go inside, and then, this is how it will go. Okay, so don't be upset that you have to take care of the time as well. No, you don't have to do anything. All right, you don't have to do anything. So just stay calm, be yourself, composed and comfortable. Okay, plus at the same time, be easy on yourself. So I'm sure, if you guys are preparing with someone, any mentor, so I'm sure almost all of the mentors teach you that how you have to behave in exam. Okay. So it's very imperative that you work on your tone, you work on your pace as well. Because if you will be, the so loud, so what will happen is, because all these partition are wooden partition. So what will happen is that your voice can be overheard by this candidate, so he or she can be distracted. Okay. So again, your tone and your pace should be of, the medium, what you can say the range. So at least you should be comfortable while talking, and, the person next to you should be comfortable as well. Okay. So these are general tips, just as how are you going to behave in exam and how are you going to be in exam. All right. So, the after that, revision strategies, it is very much important. Okay. Because revision, important points, the what you can say, if you have made any, so yeah, you have to revise them. So what good candidates do is, and what researchers have said, that even if you have read a lot in the previous months, but if you have not revised important or the exam essentials right before exam, so there are high chances that you may miss something, that you may forget something. Okay, so the successful students use the variety of the learning strategies. For example, they do the retrieval practice. Okay, so they will recall, they will, the again practice the same station, they will elaborate, they will discuss, they will, they bring examples, right? So they are going to be, they're talking about that. Plus, it is very important that you discuss. Okay, you do try to perform. So even if you don't have any your of your study buddy, so do try to the practice 1, 2, 3, whichever suits you in the last few days, just to the bring yourself into that mode. Okay, so it's a good idea that you practice. If you don't have any study buddy, if you don't practice with someone, so we do have another strategy: practice with yourself. Record. Record yourself for 10 minutes, okay, with the timer on. So record yourself and then be your own critic, be your own judge. Bring, your own mistakes, highlight your own mistakes. And of course, if you have done it brilliantly, pat yourself as well. Okay. Or the third idea is that practice with the mirror. Look at yourself, okay? Then try to note your expressions, try to note down what good you do, what bad you do, what exactly do you need to improve on yourself, okay? As a whole, as a, the doctor, complete package. All right. So RCOG, or you can say that, the NHS is looking for a complete package. They don't need, what you can say, the highly qualified personals, even if you are working in your own respective countries as a specialist, so they don't need them. They need, the MRCOG graduates, okay, MRCOG members only, because for maybe, the overseas candidate, it may be, the extra, what you can say, the membership exam, but for NHS, it is essential. It is important for them to even, by the time they will enter into their, the subspecialty training, so they have to finish their MRCOG. Okay, it is mandatory from their syllabus. Okay. So, for this, for the last, okay, let's talk about the last 15 days. So what you need to do is that you have to plan, okay? You have to schedule. Again, self-care is very important. Okay, I will talk about the self-care as well. Then you have to practice, you have to revise. Then, of course, many of us are going to be traveling outside. Okay, so travel plan, because travel stress, travel and anxiety is another thing. Then you have to prepare for your big day, right? So it is very much important that you try to plan, and then of course try to execute that plan as well. So it has to be very good. And again, most importantly, be easy on yourself at all times. Okay, so even if you don't study one day, it doesn't matter, you can cover it next day. Okay, so don't hold the what you can say, the grudge of the previous day to the next day. Okay, move forward, doesn't matter. All right, this is you, this is your exam, so I'm sure you can do it. All right, then everything starts with a plan. All right, we all know that. And I think we being a doctors, we are much more familiar with all these plans and schedule because, many of us are taking care of our households, our, the kids, our family. So yeah, we do try to plan, isn't it? So take this exam as an other exam and just try to be calm, just try to be composed, and then, to go for this exam. So now we do have almost, you can say the 10 to 15 days to be exact. You will break down all your important modules into these, the 2 weeks, all right? Then you can personalize it according to your preference and difficulty level of each module, isn't it? So many students, they face difficulty in core surgical skills. Many students, they face difficulty in the oncology, maternal medicine because it is very vast and it can be coupled with antenatal care. So, you divide. For example, for the big module, you can give 1.5 day. For small module, you can give half day or 1 day. So it all depends on your own understanding. So you can personalize it according to your, the difficulty level of that module. Again, keep in mind that you should start with the module or the subject that is most difficult for you. Okay? Don't keep that difficult thing for the end. So what will happen is that initially, you are going to revise it. So sometimes what will happen is that, your brain will always make excuses to keep it for the last, but don't let that overpower you. Start with the most demanding subject first. Okay. So do try to bring a study plan. So for me, because I have been through so many and countless exams, so what I do is always, I do try to make a study plan. So every month I have a, the monthly planner, or you can say the yearly planner, and my, the many things are already planned, of course. And day to day, we can have some variations, and day to day we can do, whichever can be done to mold according to our responsibilities, other responsibilities. Okay. So for example, for antenatal care, you can do, the 1 to 4 stations every day. Then maternal medicine, for a few days you can do that. Then post-operative care, core surgical scares, and then oncology. So this way, what will happen is that you can see that, at least in these 15 to 16 days, even if you do 5 stations every day, so you can at least revise 80 to 90 stations. 80 to 90 stations does not mean that you are just doing the stations, but you are revising your talks, guidelines, or whichever important points which are necessary for that particular topic. So do try to do this. And again, important tips should be in the schedule that you have to revise important points at least daily, 5 to 6 stations practice. All right. Then revise guidelines and talk points. Don't just do simulated patient tasks. Don't just focus on ready-made templates. Okay, for example, I have, there's so many, the mentors course material. So I'm just going to revise, I'm just going to study, I'm just going to listen to all those lengthy records. Okay, there's no harm in it. But what are you doing in the end? You are not, the practicing yourself. You're just listening. Okay. So in the end, what you can do is, yes, you can do that. Okay. But tailor according to your needs. More focus should be that, you have to revise your, the own guidelines, you have to revise your own stuff, and you have to, do the station practice as well. Then don't just attend so many sessions around, listen to just audios or videos. But it's very important that you have to do the regular brainstorming with your study buddy. Book 1 to 2 mocks to have a corrected version of your preparation. It's always recommended. Okay. Because the of course, even if you are studying, even if you are the practicing with somebody, so you may have the some of the, what you can say, that drawbacks which can be corrected by any mentor or any teacher, isn't it? So according to your own feasibility, according to your own the needs, you can book the 1 to 2 mocks with the your mentor. Plus, don't take any feedback on your head. This I have felt, the so many times that if we give any kind of feedback to any, the student, so sometimes they mind, sometimes, they get upset, sometimes, they get depressed that, okay, I'm not ready for this exam because, I didn't do this station very well. So I'm not going to go for this exam. No, 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 don't do that. Okay. In the end, what exactly do you need is that you need to polish whatever you have read, whatever you have done in the, the previous months of your preparation. Okay. So don't take any feedback on your head at all. Be the best version of yourself in every station. This is what I say since I have started coaching or teaching. You have to be, your own best version in every station. So you don't need to lose your, the calm. You don't need to lose your cool. You don't need to lose, your strength even if you have not done the previous station correctly or it is not up to the mark. So don't be upset about it. Okay. So don't be upset about it. So be extremely careful that, again, I always say that be easy on yourself. Okay. So this exam is like another exam. Okay. So it's not, the matter of life or death or something. You just need to be okay. You just need to be easy on yourself. All right. Am I making sense? Am I clear to you all? Hmm? Yes. Thank you. Thank you. Thank you so much. Very good. All right. Any questions so far? Hmm? Any query if you think that, I need to address? Because, the many a times I do get, the queries regarding what to wear, how to behave, about shoes, about your appearance, about your, the last days, the practice. So it is very much important. Tayyiba, is it with the skin? Tayyiba, Dipti, yeah?
Yes, ma'am.
Okay, okay, good. Okay, if we talk about self-care, so what exactly the self-care is? That of course, because if we are in, the our in anxiety mode, so what will happen is that our GI system will not work properly or say the effectively or efficiently. So what can happen is that, we may develop some kind of, the GERD. We may develop any kind of, any, the stomach problem as well. So what you need to do is that you have to eat healthy. You have to eat regular meals. Avoid, the fatty or spicy meal. Sleep well for at least 5 to 6 hours in a row. Okay, at least 5 to 6 hours in a day as well, and regular walk or meditate if you wish to. Okay, or if any of you does any regular exercise, so don't discontinue just out of the stress, do it. Okay, this is important because at the same time when you are studying, you need to relax your neurons as well. Watch TV, listen to the music, but avoid thrillers. Okay, avoid thrillers. So what will happen is that, the thrillers will again eat your neurons. Okay, they will weaken your, the capacity to think. All right. So you need to be again, the very, very easy on yourself, and you need to be calm and cool just right before exam. All right. So be extremely, the good to yourself. Then again, the like I said earlier, that you need to book mocks. It is very much important. Okay, because it will just enhance your presentation skills, and these you may get some extra tips. You may get some, the tricks to pass this exam as well. So what is your ultimate goal? Your ultimate goal is to pass this exam, isn't it? So you need to do that. So I think it's a good idea because these days almost all virtual exams, mocks are there, and even your these face-to-face mocks are there as well. Okay. Is it okay if we practice books in the last? Of course, you do have stations from the books. Okay, so you just need to choose your, the own task, your own modules. Okay, and if you think that okay, I'm little bit what you can say that weak, or this is not my strongest module, so you are going to choose that from any book, and you are going to do. If we talk about book, so how I used to do with my study partner, back in 2018 was that we used to do, for example, if we have to do the core surgical skills module, so we will keep all 4, 5, 6, whatever practice books do we have. Then we are going to find out that, okay, this book has 2 stations, this book has, the 5 stations, this book has this. So we will try to, do them. Okay, so this way, of course, it is going to be very easy to assimilate, and it is going to be very easy to, the revise, isn't it? So this is one technique. And the second technique could be that either you choose only one book. For example, for me, I find the Oxford Specialty Task, Justin Pune book very good. Okay, so either you can pick one book and you can finish it end to end. This is also one of the the good idea, because if I say that in Justin Kone book we do have the four mocks complete, and the rest of the few mocks as well. So 14 and 1428 and 56, almost 60 tasks are there, isn't it? So if I talk about Oxford Specialty Task book, so it has almost 89 the task. So I don't think that they are less. Even if you to try to revise one book very the wholeheartedly, end to end, okay, cover to cover. So I think you can have a fair chance that you can revise your syllabus in a good way. Again, your strategy should not be just to practice. Your strategy should be that, okay, I have to cover this topic, the end to end. I have to, read my talk article. I have to read my Green Talk guideline, or I have to do the, whatever guideline talk, or, which PIL, yeah, patient information leaflet. All right. And then again, make sure that patient information, some of the patient information leaflets are based on old guidelines. So you are going to bring your, the new guideline. Okay. But again, it has to be in the patient friendly language. All right. So then again, you have to travel and you have to go to your, the respective destination. And this is RCOG, London. Okay. If you have booked any overseas, the city, or, the country, so make sure that you have your all visa arrangements, that you have your, the stay arrangement as well, because this is also cumbersome. Okay. Keeping in view of, the inflation and, the everything. So make sure that you are choosing everything wisely. And of course, you must have by now. So, but still, some of the time, and in fact, many times, travel anxiety is there. Okay. And many people, they are not comfortable traveling alone, so they may take their any of the family member. So of course it's also cumbersome, and it also they require a lot of finances as well. So make sure again, the at all times you keep yourself the calm. Okay. And people, many at times they ask that for the how many days prior to exam we have to reach. For example, if you have to travel, for example, if you are traveling to the London or Malaysia, or you have to travel to Hong Kong. So of course, I mean, they are long haul flights, isn't it? From every overseas country. So you need to travel at least, I must say that at least 3 to 4 days, because then you can have, the sometimes you can have any kind of the jet lag. Okay, any you may fall sick because of the extreme temperatures. Okay, because these days the Asia is facing very hot the temperature, but yes, the UK, Ireland, they are the relatively cold to for us. So some of the times the change of the weather brings a lot of the changes, plus time differences there as well. So make sure that you have every consideration in your mind. Okay. So, and it's a wise and good idea that at least travel 3 to 4 days before exam. Never travel one day before, and never reach just right before exam. Even if it is in your own country, do try to be close or near to the exam center. Okay, even if it is happening in your own country, please. Okay, so because this way, what will happen is that you will save yourself from unnecessary anxiety, unnecessary, because anything can happen. So make sure that you are on your respective, the exam destination for about, like, in the same country, 12 to 24 hours, and outside the country, 3 to 4 days. Okay, because then at least you will be okay. You will be fine. Just right, the before exam. Then what happens is that, of course, you are going to be, the prepared. You are going to be, the go for your exam. And for 2 minutes time, of course, you have to read your task carefully. You have to check what domains are being tested in that particular task. Don't start making keys, for God's sake. Okay. I do see so many candidates that in 2 minutes time, they will just start making, the so many keys. I mean, how is it humanly possible to make keys and to remember each and everything for those 10 minutes time? I don't think it's possible. So what exactly do you need to do is that at least you can write down, because you will be given the notepad, a pencil, and doesn't matter, even if you they forget it, you will have another one, extra one, okay, outside. So don't be upset about anything. Don't try to recollect things, okay? Whichever, even if you have forgotten something in one cubicle and you're moving to the next, without your, the notebook or something, don't be upset. Grab from, the outside, because after every cubicle, or I think, or center of the exam hall, you might, the see a big table, and there will be a pile of pencils and the notebooks as well. So don't be upset. Then for 2 minutes, because if you are standing outside, you might see so many pages pasted on your cubicle. Don't be upset again. Okay, the same are going to be, because even if you have not finished reading all papers in 2 minutes time, so all these papers are going to be pasted inside the cubicle on table as well. All right, so don't be upset. Your task is, at least you have to read the complete, the task. In the initial, the beginning, there is going to be written that all these domains are going to be tested. There is going to be a question, and then there is going to be a task. So make sure that you finish your task in the next 10 minutes time. For example, if there are a couple of, the labs pasted outside, okay, just try to scan them, even if you have not scanned them properly. So you can scan them inside. Okay, so once you will enter into so what you need to note down, that what domains are being tested. Okay, check whether it's a referral letter or no. If it is a referral letter, then from whom? Okay, then you are just going to formulate in your head. Again, don't verbalize at that time. Okay, because some of the students, they do have this habit that they will start, the reading, and they will start talking to themselves. Okay, I have to do this, I have to do this. So this way, what are you doing? You are putting extra stress on yourself, plus, the person standing next to you. Like I said earlier, that, the exam cubicles, exam hall is going to be very narrow, and that you are going to be facing, I don't think that, you are going to be having a long distance from one student. Okay, then formulate, how will you start your station? This is important. How will you start your station? How will you set your agenda? Again, agenda set should not take 2 to 3 minutes, and it should not have long sentences. And again, you should not bring your fancy English. Okay, be extremely careful that, when you will enter into the cubicle, what should be your body language? What tone should be acquired by you? Okay, how are you going to start? And when you are standing outside, you have to check it's a referral letter. What I do for myself in almost all exams, that I just note down age of the patient, name of the patient, because it doesn't look good that in the previous station your the patient was Claire and the next is Nancy, and you start the calling Nancy as Claire all the time, or Helen is in the previous station and the next station is the Emma, and you are the calling her Helen. Okay, so it doesn't look good. If you feel that okay, you are making a mistake, so come back. Just say, okay, oh, I'm sorry, I forgot to ask your name. Can I double check your name, please? Okay, can I just could you please tell me your name again? Okay, with a half smile. So it's not going to do any harm to you. All right. So, but it's not a good idea, and it will not give good impression that if you are calling somebody with someone else's name. Okay. So what I do, let's come back. What I will do for myself, I will write down the age, name, and the presenting complaint, and what my task is. That's it. And then I will stand. I think that can be finished in almost like 40 to 50 seconds. And the rest of the seconds can be utilized that how am I going to start my station? That's it. So speak to yourself and just think that, how am I going to start my station, and what should be my strategy when I will enter into the cubicle and when I will start my station. Okay, clear everyone?
Yes, ma'am, it's clear.
Okay, brilliant. So, with this, what you will do, then you will enter into the cubicle. Okay, you will enter into the cubicle and then you will start your station, of course. So you should look confident. You should enter into the cubicle calmly. You should familiarize yourself with the cubicle. Again, very good idea. For example, if you see only one person standing, next to the table, so most of the time it is structured discussion task. If you see that this is table, this is chair, and this is chair, and this is your chair. So this is examiner, this is role player, and this is you. But if you see two chairs, role player and you, so most of the time it's going to be the lay examiner. Okay, so don't get confused. Plus, don't look at the examiner or lay examiner at all. And don't expect that they are going to pat you or they are going to smile at you that, okay, yeah, you have done something brilliant. Brilliant. No, never expect. Because they are going to be with the masked face. They are going to be with, the very stern, you can say expressions. Okay, they're not going to smile. They're not going to give you any assurity or anything. Even if you are talking, whatever you are talking. Even if it is good, okay, even if it is good, even if it is bad. All right, just focus on role player. This is your exam. These should not be, the anything for you at that particular, this station. So try to finish your task with the respective domains. And even if you have finished your stations before the bell rings, sit comfortably. Don't exchange glances with anyone in the cubicle. And don't expect again, let me repeat myself, that don't, the expect that somebody is going to give you any assurity or reassurity that yes, you have done, the brilliant, oh no, you have done, the extremely, this was a splendid task or something. No, not at all. Okay, not the examiner, neither the role player is going to give you any clue that what exactly you have done. All right, so make sure that this is your exam. You are well prepared for this exam, so don't expect anything from anyone in the exam. All right, so these are the general tips and the tricks. Again, so once you are going to be in the cubicle, you are going to start your station. You are going to introduce yourself. Again, your introduction should be very crisp, okay? Plus, situational awareness should be always be there. If you are in urogynecology clinic, so you have to say, I'm one of the doctors in the urogynecology clinic. If you are seeing your patient, in the absence of your consultant, you are going to apologize. Okay, so you are going to say that any sentence you can bring that at the very outset, I would like to apologize that my consultant is away, so I'm going to conduct this consultation with you. Would that be okay with you? So again, like this. So, or you can say that, I apologize on behalf of my consultant that he is not here today to talk to you. So I'm going to be conducting the consultation. So is that okay with you? So like this, any sentence you can bring, whichever you are comfortable with, whichever you have familiarized yourself with. Okay, so bring that. Then you have to do the agenda set. Agenda set is okay, but it does not mean that it is, what you can say that it is a must thing to do for any station. All right. So you can simply say that, okay, so for example, this is Lucy. Okay, so Lucy, do you have any, the expectations from today's consult? Yes, doctor, I want to know about this. Okay, all right. So Lucy, what I'm going to do is that I'm going to be talking about this particular thing. I'm going to give you the management options, and then I'm going to give you all pros and cons, and later I will, give you the patient information leaflet to supplement the talk. And if you have any question, you can ask me, or in the end, in the middle, or even you can ask me in the end as well. Anything you have, the prepared or familiarized yourself with is okay. But again, don't read the question to patient in the beginning when you are setting your agenda. That Lucy, I know that you are 32 years old and you have complained of this thing for the last 5 years, and you have had all these medications, and but it didn't work for you, and today you want to know about the laparoscopy or something. Okay, so again, this information is for you. Whatever is given outside the cubicle is the information for you, not it is not for the Lucy, that you are not going to narrate the same information to the Lucy. No. All right. So make sure that you are picking the positive point. You can simply say that, Lucy, let me reconfirm your name and age, please, that you are Lucy and you are 34 years. Am I right? Yes, doctor. Okay. So Lucy, I understand that you have some problem with your waterworks, and today you want to know about the treatment options. Am I correct? Yes, doctor. Okay. So can you please tell me in your own words that what exactly are you having at the moment, or why are you here today? Or even if nothing is given outside, or you think that, okay, I have to dig out history. So then you have two, the ways to dig out the history. Either it can be direct or either it can be, the closed, the question, or it can be the open-ended question. The closed question simply ask the patient that, how can I help you today? How can I be of any help today, Lucy? See, this way she will start her own, the complaint, her own story. Or if you think that, she is dragging too much, then you can simply, say that, okay, Lucy, I understand that you have these problems, but let me just ask you quickly that, what exactly is bothering you the most at the moment? Maybe she has 1, 2, 3, 4 complaints. Okay, so for the start, for initial, the 30 seconds, 40 seconds, you will just listen to her. You may say, you may do humming, you may say, okay, you may say, all right, you may say, it must be very painful. You may show some sympathy to her, the complaints. This is called, the communication. Okay. Here I want to address one more, the important thing to all candidates. Many candidates, because I'm conducting mocks these days, so many candidates, they have learned that, okay, they're doing all the time is very, the cool. Trust me, it's not cool at all. And it doesn't look cool at all in the exam as well. All right, because the humming is okay, but I mean it's not a good idea that all the time you are doing this all the time. Okay, it looks very absurd, it looks very bad, and it sounds very good as well, very the bad as well. You may use sometimes you may see okay, you may see all right. If you think that she has told you something which she has quit, then you can simply say okay, brilliant, that's very good of you to do that. Okay, if she is telling you that I'm having this pain, you can simply say, oh, I see, it must be very, the painful. I understand. This is quite understandable. Okay, that it must be very painful. Don't say that I understand what you are going through. Okay, how can you understand? How can you feel my pain? Have you ever been in the same boat? Have you ever been, into the same painful condition what I am having at the moment? No, right? Or maybe, or yes. But in the exam, don't say that. Okay. So these are, the general, the small tips. Then you will check whether it's a GP referral letter. Then you will perform your station. Make sure your history taking is almost, if you are, the good enough. So 3 to 4 minutes are more than okay. 1 minute introduction and agenda set, 3 to 4 minutes history. Let's say 5 minutes are gone and now you are left with 5 minutes. In the next, the 3 to 4 minutes, you will manage your case. Again, if you are managing your case, for example, if you have, there's so many options, treatment options. Let's say example of, for example, miscarriage. Okay. So we all know that miscarriage has got, the 3 types of, the management option: conservative, medical management, and then surgical management. Okay. So when we talk about, the conservative, so always, in any case, if you have couple of management options, so you can simply say that, okay, we do have couple of, the management options available for you. Okay. So at least name them in the beginning. Don't say conservative and then start talking, the lines and lines and lengthy sentences for conservative management. You can simply say that, okay, so we do have management options for you. So 1 out of 3 option you can choose. Let me tell you that, the all options has its own pros and cons. And like we do have conservative management option in which we are just going to wait and watch, or we are going to let the nature takes its course. The second option is the ending the pregnancy with the help of medications. So we do have 2 types of medications in that. I'm going to be talking about that in a bit. And then third is the operation or the surgical management option, in which we do have 2 types of management options, in which one we are going to evacuate the womb with the help of, the suction, the pump, cannula, or we are going to do it with the help of the curate. Okay, so we do have, all these options, and every option has its own pros and cons. Would you like me to tell you, the more about, or, the every option? Yes, doctor. Okay. So, give information in chunks again. After giving conservative management option, at least you have to tell about, and again, another grave mistake. Don't say, okay, apart from this, for example, I am a patient and I'm here to talk about the laparoscopy. Okay, so what many candidates do in the beginning is that it has got some risk involved in the laparoscopy. For example, we do have the minor risk, we do have major risk, we do have, the reversible risk or the irreversible, whatever, okay, these kind of. So my advice is going to be that at least say something good in the beginning, and then comes and then they talk about the risk or the the whatever. Okay, so at least say something the nice, so at least patient have a good idea, fair idea about what she is talking about, what she is going to be offered in her the complaint. All right, am I the clear so far? Any question? Any question, guys? Okay, nice. All right, all right. Thank you, thank you. So I assume that everything is clear because everybody is so quiet and listening. All right. So if you have performed and almost the 5 minutes here, so you can perform in either 4 minutes, but this is going to be my suggestion that at least the reserve last few seconds or 1 minute for the closing of the loop. You can write back to the GP. You can simply say that, okay, so Emma, we have discussed that now you are going to opt for the conservative management. So, I mean, I'm going to be the writing back to your GP, whatever we have discussed today. I'm going to give you the patient information leaflet or the web links to read, the more about it. So plus, I'm going to give you the web links of the support groups as well, where you can go and talk your heart aloud, to the women who have had the similar or almost the same cases like you. Okay, so if you have any question, you can come back, or if you have to give any 24/7, the contact, the details you can give. Or you can simply say that Emma, at any times if you feel that you are having, the tummy pain, which is not getting relieved, if you are having heavy bleeding, or if you think that you are, the having any, the running any fever, you will immediately rush to the hospital. So I will give you contact details as well. Okay, so this is how you manage the case. Again, please remember that you don't have to bring your the lengthy guidelines into one station. Remember, you don't have a lot of time available. You just have 10 minutes in which you have to start your station, you have to manage the case, and then you have to close the loop, you have to write back to the GP, and then you have to inquire about her the questions as well. In the end, you can simply ask that, am I clear so far? Do you have any question to ask? Or would you like me to repeat anything for you? Anything. So be extremely gentle, be extremely nice. Your, the tone should be very polite at all times. Okay, your expressions should be very neutral. You should not be smiling all the time. You should not be, it should not be a wide smile. However, you can half smile if you really wish to. And from 2 minutes time, I think you can get a clear idea that how are you going to behave into the cubicle, inside the cubicle, right? So again, altogether, this exam is all about your complete package as a whole, okay? How you behave, how you talk, how you execute, how you bring your knowledge into your clinical practice. And of course, because you are just given 10 minutes, so how are you? So this is an average consultation, okay? That's why we are given 10. So 10 to 15 minutes is the average consultation time, okay? Until unless somebody has any complication or, he or she needs any extra time. So that's why they are, the preparing us that if any of you have to go to the NHS and start working over there, so at least you will have a fair idea that how are you going to start your consultation and, the talk to the patient as well. Okay, clear everyone? Any questions so far? Any question? Okay, very good, the scheme, very good, Dipti, very good, brilliant, brilliant. Okay. All right. And then, for every station, you should understand the following issues clearly. That if you think that if there is any conflict involved, if there is any agenda of undermining and bullying, okay? So undermining and bullying is not going to be straightforward. However, you can only judge it from the patient's tone, from her body language, from her, the expressions, from her lack of interest, from her not having eye-to-eye contact with you. All right. So all these things will give you a clue that, okay, something is wrong there. Okay, so it can not only be the undermining and bullying, it can be any case of the abuse, be it the any domestic abuse, sexual abuse, or any the workplace the harassment or anything. Okay, so at the same time, if you feel that you have to manage any angry patient or relative, she is not happy with the care given or provided to her. Okay, she wants to raise a complaint. So at the same time, you don't need to be very defensive, even if that thing has not been done by you only. Okay, so never be so defensive. Always the accept, always say the mistakes are part of our the practice, and it's a good idea that you have come to the see me, and you have come to discuss with me. So together we are going to look into it, that what exactly has gone wrong and how we can prevent it in the future to happen in some other one. At the same time, if you think that somebody is here to talk to you regarding the care provided to her was not the matched with her expectation, so you can simply say that I'm so sorry that the that the care provided to you didn't match with your expectations. Okay, however, what we can do is that we can talk and we can find out that what exactly has gone wrong at that time. At the same time, say that I'm so sorry that I don't want to bring back those, the bad memories for you, but it is going to give me the idea that, what exactly has happened to you at that time. So can you please tell me that what exactly has happened? For example, there is a very famous scenario of, the retained swab. Okay, there is a very famous scenario of third degree, fourth degree perineal tear, and she is here for postnatal debrief, for postnatal counseling. So always remember that you will be expecting, the somewhat angry, somewhat anxious, somewhat you can say that, the patient who is not happy at all, right? So at the same time, of course, if that complication has not been done by you, but what you need to do is that you have to maintain, the dignity of yourself, your colleagues. At the same time, you should not be very defensive that no, 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 I don't expect that this can happen, because all of us trainees or all of us are very much the confident, and we are very much signed off to do the any procedure. So yeah, I mean, and plus another mistake in the core surgical skills and post-operative care, that look, we have given you patient information leaflet when we have spoken to you in the clinic about this particular option, that this complication can happen, this complication can happen, so this has happened. No, no, this should not be the case, okay? Never say that. This is also a bad idea to say this, okay? So you can simply say that, we have that, I mean, if you remember that we have discussed earlier in our consent that all these complications are part of this, the operation. However, with the expert hands, complications can be minimized or complications can be minimal. However, in your case, I'm afraid the reason for the complication would be this. If you can dig out, if you can find out, or even if not, don't put a blame game, okay? Don't play a blame game. Don't put any blame to any of your colleague, because then it will come under the heading of bullying or the undermining. Okay, it means that you're not having the good communication, or you're not having good practice with your fellow colleagues as well. Okay, again, then another important thing, principles of confidentiality, very important. Confidentiality should be maintained at all times. Okay, for example, if there are any sensitive issues involved, again, another grave mistake what candidate do is smoking and alcohol. And pardon me to ask, do you smoke? Pardon me to ask, do you drink alcohol? Pardon me to ask this. Why pardon me? Smoking or the alcohol binging is very common for them. So why do you have to be so much? Why do you have to signpost for everything? You can simply ask, okay? Or you have to ask for sensitive thing. For example, if you want to inquire about multiple sex partners, if you want to inquire about anything particular which you think is quite sensitive for that patient, so in that scenario you can simply signpost, but not for the smoking, not for the alcohol, and not for like recreational drugs. Pardon me to ask, pardon me to ask. So I think everybody should cut this thing. Okay, even if of course for many of us alcohol, smoking, or drugs are not going to be that the common, but still the society we are dealing with at the moment, so that's the pretty normal for them. So make sure again, Not, don't send every smoker, don't send every, the alcohol, the drinker to, the NHS Stop Smoking Cessation Services, NHS Stop Alcohol Services and all. Okay. So yeah, 1 to 2 cigarette. Okay, although it is bad, for example, if we take the example of pregnancy, although it is bad because no amount of alcohol is allowed, no amount of smoking is allowed in the pregnancy. However, if she is having, the 1 to 2 cigarettes a day, so you can simply counsel her. What you do is that, okay, you are asking me, pardon me to ask, do you smoke? Yes, doctor, I do. Okay, so don't worry. We have a very beautiful, the department, the NHS Stop Smoking Cessation Services. I'm going to send you to them and they are going to give you. So you can just imagine that how much time are you losing only in this, the unnecessary stuff. Okay, you can simply say that, Julie, I understand that you're smoking, but let me tell you that it is not, the good overall, and it is not recommended to smoke in the pregnancy because it's not good for you and your upcoming baby. So, what do you think? Are you going to, reduce the number of cigarettes, or are you going to be able to stop the smoking altogether? Yes, doctor, I will try to if it is good for me. Yes, Julie, it is good for you. But if she's smoking half a pack a day or full pack a day, then yes, she needs help. Because if I am smoking 12, 15 cigarettes a day, so of course I need strong motivation, the strong, which you can say the counseling to, the stop this smoking. So of course I need help in that scenario. But just imagine that if you are sending every woman to your, the fellow colleagues, what exactly are you doing? You are putting extra burden. You are putting unnecessary burden to your fellow colleagues. It means you are, the kind of jeopardizing communication with colleagues, isn't it? Are you there, guys? Is
Yes, ma'am,
everything
you're
clear?
true.
Okay, brilliant. So then comes audit and risk management. I kept this in the end. Why? Because for the last two exams, they're not bringing audit and risk management as such. However, this is part of our syllabus. So I would suggest and recommend that at least just go through once. So just to have an idea, because in our countries, we are not familiar with, the audits, we are not familiar with the risk management, but still you need to know that what are the steps of audit, what are the steps of risk management, how to do is, and how to, the maintain it. Okay, and how to, for example, if you talk about the audit, so yeah, we do have 6 steps of audit. So at least everybody should know that risk management, 3 to 4 steps of risk management. So yeah, at least do it. Do it once or twice, or they don't bring the so many cases and don't practice because for the last two exams there were no audit and risk management cases according to my understanding. Okay, but still because it's part of our syllabus, so it's a good idea to just go through once. All right, then comes labor board, nightmare of all students, including me. Labor board, tiny board, yeah, pre-op list, post-op board round. So all these things are very important. Again, I'm sure you guys are, the doing it with your respective, the mentors, or if you guys are enrolled with someone, or even if you are not, if you must have practiced. So my advice is going to be that yes, this is very important for exam. None of the exam is going to be, the without labor board, having labor board, or without having, the gynae pre-op, post-op round. So at least, they are going to bring 1 or 2 in every exam. All right. So make sure that you are doing it. Make sure that when you do, the labor ward prioritization or gynae ward prioritization, or the post-op round, so make sure that you have a 360-degree look on the complete board, because in the labor board many at times you will get 13 rooms, 11 rooms, but it does not mean that in every room you will get the patient. Okay, you might have patients in all the 4 to 5 rooms only, and the 6 rooms are empty. But still, the 1, 2, 3 patients, 4 rooms are empty. And then what you will do is that you will spend a lot of time in these 3 rooms. And then by the time you will reach into your, the next station, you will lose your time. So my advice is going to be in these scenarios that at least have a 360-degree look. 360-degree look means that at least quickly go through in your 2 minutes time, or while you are entering into the cubicle, that what exactly are the cases. For example, in the room number 8, cord prolapse is there, but you are managing all these cases. But cord collapse is emergency. We know PPH is in the 9 room. And we all know that PPH is very dangerous, right? Patient can lose her life because of the bleeding and all. So what is imperative? That you will always choose emergency first. And then you will, doesn't matter if in the room number 1, it's a cold case, it's not that emergency. The room 2 is okay, semi-urgent. Okay, in the 3, it is non-urgent. But have a complete look from 1 to, it doesn't matter how many rooms are with you at that time. Okay, 8, 9, 10, but at least have a 360-degree look. Or you can say that, the quickly go through complete rooms, and then you are going to manage according to the needs. So what will happen is, by the time you will reach into your room number 9, and this is PPH, so what will happen? What will happen? She may die. She may be into a danger. Okay, she may be into a lot of trouble, just because you were managing the the pre-op list. Here it was breech, and she's scheduled for cesarean section, and you were talking the unnecessarily about the method of delivering of the breech on the cesarean section and all. So that is unnecessary. Okay. So this is another, the query which I receive almost on daily basis, that how to go about labor board. So there is no, the fixed idea from any mentor, any syllabus. Okay, it all depends on how do you train yourself, how do you, the rehearse, how do you try to manage all these cases. But always remember that, and don't bring SBAR tool in every, the case, because yes, nonetheless, that is a very good tool, and this is what we do in our day-to-day practice. But I think for 13 cases, it's not going to be a wise idea. Okay, but still, yes, for handing over, SBAR tool is very important. Okay, so go through all these cases in the last 15 days, important ones. So at least have a look, have an idea from the previous question pool, that what type of questions are being asked and how they are going to be they manage in the exam, and most importantly, how are you going to execute. Okay, my the humble which you can say the observation out of all these for the last 6 years I'm teaching. Okay, so my observation is the very broad by now. So what I have observed is that almost every candidate is well prepared for exam. Mark my words, almost every candidate is well prepared for exam. Okay, because now for the last the 3 to 4 years, there is a lot of the help available, help in terms of free help. Okay, you do have YouTube channels, you do have many brilliant mentors who are teaching selflessly. Okay, around, there are many mentors who are conducting the regular mocks and everything. Okay, yes, paid the facility is also the available, and then the mocks are there, online mocks, physical mocks. So yes, help is available. So you can see that almost every candidate is prepared for exam. But why do candidates fail? Still, why do candidates fail? So the major reason for the failure is that if I'm the prepared in a good way, but still I'm failing this exam, it means my execution is bad. So what difference is going to the make in exam is execution. Okay, how do you execute that particular station? Always remember, all of you guys are brilliant. Okay, because all of you guys are prepared for this exam. But the way you behave in exam, the way you execute that particular station, that is going to make a difference in exam. Okay, so this is how. And again, number of courses, I have attended 5 courses, I have 10 courses material with me. That is not going to give you or that is not going to to put you on certain the higher level to any candidate who has not attended so many courses or mocks. Okay, so again, it's not a guaranteed thing that, okay, if I have attended so many mocks, if I have attended so many courses, so I am guaranteed, I'll pass this, the exam. Again, always remember, it's your execution. How do you execute the station that will count in exam? Okay, not the number of the courses and mocks and everything, because trust me, when we were preparing for this exam back in 2018 and the 19. Okay, so it was very difficult for us because there was very less help available. And we always had, the no online, the courses or no online teachers, but yes, physical, the mocks were there, and that too in the UK. Okay. So it was, the very, very, it was very difficult for us. All right. But now I think it is very easy. A lot of help is available. So you can have, the help in terms of either it is a paid mock, either it is a free mock or anything. For me, yes, I am doing free mocks as well. And I have had a opportunity to book, the couple of, the free mocks with many candidates. So plus, the paid candidates are always there. So yeah, it happens. I have a query. Staff. Yes. So you can simply say that, in the beginning when you are, starting your session, you can simply, because you have read the scenario, right? You are taking a handover, right? So what you will say that, I'm one of the candidate, one of the exam candidate, and I have the opportunity to do this labor ward prioritization. And I am taking charge at 8 o'clock in the morning. And I have 7 staff with me, 3, these nurses, one, the ST2, ST3 colleagues, one anesthesia, the colleague, ST3, and my consultant is on call, and I'm going to be doing. So how am I going to do in the labor board is prioritization. I will have a 360-degree look on the the labor board. I will pick the emergency first. I will manage it, and I will allocate all my available staff according to their the training and the designation level, and I will involve my consultant wherever it is necessary. Okay, so if you will say that in the beginning, so examiner will have an idea that okay, this girl or this candidate knows that how to manage this labor board. Okay, the scheme clear? Hmm? So then you will
Yes,
go.
ma'am. That, yeah. Actually, there were different ways. They were telling that time will be gone in that, while you are repeating the same which is written.
Yes.
So, yeah.
So that's why I'm saying that if you say in the beginning, so it's a good. So room number 1, you have allocated your ST1, okay, a GP trainee. Here you have allocated your nurse, one nurse here, one anesthesia colleague here. But this is, the PPH. So in PPH, you will go yourself. Any emergency, you will pick yourself, you will involve your consultant, and then you will say that, I will call my this, the trainee, I will call this my nurse if she has done, the managing that so and so case. Okay, so this is how you manage. All right. So this is how you are going to manage the labor board and the gynae ward list as well. The same is going to be with the gynae ward. Okay. So again, pick your emergency first. Have the complete look on the one the board which is in front of you. Try to pick the emergency. Try to pick that which are the emergencies. So most senior person will go to that emergency. Okay, and the junior one will take charge of the the cold cases, or you can say the day case procedure, or the non-emergency cases procedure. So this is how you manage this case. Okay. All right. Okay, so this is how you will be in your exam, and you are going to be, the after exam, you are going to go for that. Yes, the skin, sure. I'm sending you number. Okay, so you can, they contact me in that. All right. Welcome, welcome. All right. So any questions so far? So far we have been having a very good session. So I can see that, you guys are having, the interaction as well. So good job. All right. So who wants to practice? Hmm? Who wants to
Yeah, ma'am,
practice?
we can.
Okay, brilliant. Okay. So let's have this session. So you will be seeing the timer for 2 minutes as well, sweetheart. So take that 2 minutes time, and then we are going to. Okay. Your time starts now. Take your 2
Ma'am,
minutes time.
1 second. I'll get to some place.
Okay. Let me pause it. Tell me when you are ready. We will start then.
Okay, ma'am. But I'm not able to see anything on the screen.
Okay,
yet.
let me. Tell me, can you see now?
Yes, yes, I can.
Okay, brilliant. Okay, your time starts now. Okay. Yes.
Hello, I'm Dr. Taskin, one of the doctors here. Can you just confirm your name and age, please?
Yes, I'm Elizabeth and I'm 26.
All right. Is it okay if I call you Elizabeth?
Yes, doctor.
All right. Yeah, I'm aware that you're here as you want to plan a pregnancy and you have a condition that's von Willebrand disease. Am I right?
Yes, doctor.
Any other concerns or expectations today?
I really want to know that what exactly is going to happen to me in pregnancy. How am I going to be? My pregnancy is going to be. And most importantly, I want to know that what are the chances that my baby can have this von Willebrand disease?
All right, Elizabeth. Yes, we'll discuss all your concerns and together we'll formulate a safe and best plan for you. Before that, is it okay if I ask you a few questions to know you better?
Yes, doctor, please.
All right. Elizabeth, can you tell me more about your condition?
Doctor, I'm having this one Willy brand since long. I think I'm dealing with this since I was like 9 years old. Because the moment I was at that time I was in the school and I was playing and I fell off the ground and I started having bleeding through my mouth, through my nose, and somehow it didn't get control. Then I was taken to hospital. Then I had the number of investigations done. Then I was labeled with this one millibrand, and since then I'm dealing with it.
All right. Okay. Yeah. And do any other family member which are affected?
No, doctor, not one millibrand, but one of my nephew. He has Down syndrome. If that is important for you.
All right. Okay. And can you tell me, was any testing done, like which type it is?
Yes, doctor, it is type 2.
All right. And anything like whether you are responding to the treatment like desmopressin?
No.
All right. And currently, do you have any symptoms like nosebleed?
No, doctor, not at the moment. Mm-hmm. Hello? Hello?
Hello?
Yes,
Yeah,
Tasneem.
hello.
Yes,
Yeah,
yes.
actually, I was not able to listen anything. Yeah.
Okay.
Okay.
Okay,
And
fine.
how are your symptoms currently? Any complaints you have, like nosebleed or?
No, 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 nothing, no, nothing.
All right. And you need any other medical condition?
No, doctor, only this.
All right. Okay, Elizabeth, can you tell me when was your last menstrual period?
Yeah, it was 14 days ago, doctor.
Okay, and have you ever been pregnant before?
No, no. Actually, I was just, the okay. I was not having any big issue. So that's why I was
Mm-hmm.
thinking, just to plan to have a pregnancy because I'm with someone to whom I think I can
Okay.
start my family with. Yeah.
Okay, that's nice. And are you currently on any contraceptives?
Yes, yes, I'm using condoms.
Okay. And Elizabeth, do you take any other drugs, medicines,
No, 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 doctor.
any known allergies?
No, not as such.
Can I ask you about your partner?
Yes, doctor.
Is your partner generally healthy and fit?
Yes, yes, absolutely.
Okay, any testing done for the similar condition in your partner?
No. No.
Mm-hmm. Okay, okay. And do you have any other significant, family history, like any bleeding problems in the family?
No, not as such.
Okay. And do you smoke, Elizabeth?
No, I do try to take myself healthy, doctor. So no drugs, no smoking, no alcohol, no nothing.
Really, that's well appreciated of you. And how's your support at home?
Yeah, I mean it's very good actually. We have recently moved in together, me and my partner. So I think yeah, we are good.
All right. And have you been immunized for rubella?
No, doctor.
All right. Actually, Elizabeth, that is one of the vaccines which we can do before pregnancy.
Mm-hmm.
And I'll just connect you for that. Is it okay?
All right. Okay.
Okay. Thanks for sharing this information, Elizabeth. Anything else you would like to add?
No, doctor. No, thank you.
All right. Yeah, nice. Elizabeth, now coming to your condition, that's the von Willebrand disease. Are you aware what does this mean and why is it there?
Yes, I know it's somewhat the genetic disease, and
Yeah.
it has a problem with the bleeding. So that's why I was very the upset and afraid to think of. I have never thought of getting pregnant in the last the years, but now I'm
Uh-huh.
really the serious and thinking about it. So I know it has got some problem with the bleeding. So that's why I want to know
Yes.
that
Yeah,
how
you're right.
exactly.
And
Yeah.
okay, okay, yeah, you're right. And Elizabeth, let me reassure you that many people, many women with this condition, they do manage a healthy pregnancy and a healthy baby, but when taken care of by the doctors and the treatment. Okay.
All right. All right.
So, however, yes, there are some risks there, which
Mm-hmm.
can be. First of all, like I'll tell you about the risk to the mother. Like it can sometimes lead to the increased risk of, miscarriage, or sometimes there can be bleeding during the pregnancy or increased bleeding after the delivery. So after
Mm-hmm.
for that, we'll be putting you under care of team of doctors. Okay,
Mm-hmm. Mm-hmm.
including the blood doctor or consultant obstetrician,
Mm-hmm.
special midwife, GP, and the counselors. Am I
Okay.
clear to you so far?
Yes, 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 doctor. Yes.
Yeah, yeah. So regarding the baby, as you were mentioned, yes, this is a genetic condition and this can affect the baby. So
Mm-hmm.
for that, we want you to connect with the genetic counselor and may require the partner testing so as to know whether he doesn't carry any gene like this. Okay.
All right. So you mean
Yeah.
to say that my partner also has to go for testing?
Yes, yes, we'll go for the testing because type 2, as you were mentioning,
Uh-huh.
it could be like there can be the dual pattern, like it can express only if one gene is present, or sometimes if two faulty genes are there. So we need
Mm-hmm.
to go for a partner testing, and we'll be
Mm-hmm.
referring to the genetist for the same. Is that
Mm-hmm.
okay?
Yes, 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 doctor. That's fine. Okay.
Yeah. So regarding your management, yes, once you are pregnant, it will be in a consultant-led care, and
Mm-hmm.
we will have booking for you in the consultant-led care, and there will be routine tests, routine bookings. Apart from that, we can have regular check of your von Willebrand factor levels. Okay.
Mm-hmm. All right. So how
Yeah.
long, I mean, how oftenly I have to go for these checks, doctor? Blood test? Because I'm also
Uh,
afraid of them as well.
Yes, we can go for at the booking. Thereafter, we can review it every monthly, and that at 36 weeks and before once you're in a labor. And we may, will be accordingly planning your delivery at 36 weeks after holding a meeting with all the doctors. Okay.
All right.
Yeah.
Right.
And you told me like you were responsive to desmopressin or not?
No, doctor, I've never had desmopressin. However, my doctor has, they advised me to keep a tranexamic acid, the
Yeah.
capsules at all times.
Okay.
So I do keep them in my, the bag all the time. Yeah.
Yes, definitely. So we'll also check that, with a blood doctor, because it's one of the therapies which can be given to arrest the bleeding.
Okay.
So again, we can go for a partner testing, or sometimes if someone doesn't want a partner testing, then we can go for, there are different methods to know whether the baby is affected or not. Would you like me to tell you about that?
Yes, yes, doctor, because I really want to know what are the chances for my baby to have this.
Yes, so we have got different tests for that. First is like if we go for an there's a, like if we go for a test to your baby, and before that, before having the pregnancy back into the womb, we look for the any affliction of the condition by doing under a lab. Okay.
Okay.
So another is while you are pregnant, there can be some tests which are the needle tests. Okay, and in that we also get exactly whether the baby will be affected or not. Or in some women, they prefer like to go to testing for the baby once the baby is born. Am I
All
clear
right.
to you so far?
Yes, 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 doctor. Okay, fine.
Yeah. So, do you have any questions till now?
No, so you said that you are going to do, the test on my baby. So is it going to hurt the baby?
Yes, like we have got the test which I told you about, the needle test here. That is done by the expertise. That is the special fetal medicine unit. But it usually goes off nicely. But there is some risk. Yeah, 1 in 200 chance of that baby they can have miscarriage also. So there are other risks also. We'll be telling you in detail if in case, or we give the written information regarding that. Is that okay?
Yes, yes, doctor. I appreciate. Thank you. Yes, yes,
Okay.
please.
So I'll be just giving you the written information. You can just go through that and let us know. And thereafter, you can come back to us for any questions. Is that okay?
Okay, fine, fine, doctor. Fine. All
Okay,
right.
thank you.
Thank you. All right. Okay, very good, the skin. So how was it?
Ma'am, actually, I wanted to cover labor and all those precautions, but yeah.
Okay. No, no, no. Let's the critique it, okay, positively, and then we will find out that what can be done to more beautify the station. All right. So what do you think? What are the good points for you? What do you think did you miss? And what do you think that you can improve? Hmm? Do you think that you have managed this case?
Actually, he's giving me a tough time. Maybe I'm not able to concentrate.
Okay, okay, fine, no problem. No problem. Okay, let me give you the detailed feedback. First of all, don't take any feedback on your nerves, okay? So take it positively, because we are here to learn, and we are here to, do some, the good thing, or we are here to undo some stuff. Okay. So make sure that you are not, the getting, the any negative vibes out of this station. Okay. Just take it as a positive, the positive approach should be there. So first of all, the good part about you. You have got very nice tone, very polite way. You don't have any communication barrier. Okay, mashallah. And your, the tone and pace is very beautiful. Okay, I have to comment on that. Secondly, in terms of when you started your, the station, yes, your introduction was good. Your agenda set was good. For me, maybe I may sound, the different, but many a times, I don't use word medical condition all the time. That you are having this medical condition, you are having, or you are suffering from this one millibrand. For example, if I am having diabetes, I am having this one millibrand for the last 18 years. So it doesn't mean that I'm suffering. Suffering is a big word, isn't it? So, and the reminding somebody that, you are having this problem and you are living with it. And if somebody is telling you that, okay, no, doctor, I'm okay and I'm living with it. So, okay, at least appreciate it. Take it as such. All right. For any long-standing illness, if we just, the imagine. So every long-standing illness is not a suffering. I'm sure you must have seen in your clinics as well that, long-standing, the illnesses, they are half or more than doctor when they reach to us, isn't it? They know more than they know about their condition, they know about their disease, they know about their treatment modalities as well. Okay, so this is going to be my, the pro tip for you for any
Yes.
known cases, that when you see any known case, you can simply ask her, okay, so Elizabeth, I understand that you are having, see, take it very, the lightly. Okay, Elizabeth, I can see that you are here to know about your pregnancy and your pregnancy journey. Am I correct? Yes. Any other particular concern? Well, no, doctor. I just want to know that what are the chances of my baby for having this? Okay, yes, that's a very good concern. I appreciate, and I very much appreciate that you are so much concerned about you and your upcoming baby that you really want to talk about that, before planning the pregnancy. Appreciate her coming into the preconception clinic. Okay, so then you will say, okay, so Elizabeth, I can see that you are having this 1 millibrand. So can you please tell me that, what exactly do you know about 1 millibrand and what type of 1 millibrand do you have? Yes, doctor. Okay, okay. Okay, yes. Appreciate if she knows. Don't, tell her that if she doesn't know anything, very factually or something theoretically, of course she's a patient. So you can simply say that, yes, 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 Elizabeth, yes, exactly, that 1 millibrand is involved in some of the bleeding because it's an important, the part in the process of the, the stoppage of the bleeding in terms of any injury or something. So if it is absent, yes, there are chances that, one can bleed in the absence of this. And since you are having this 1 millibrand type 2, so yeah, there are chances that, your baby can have this. So here I want to ask about your partner. So has your partner ever been tested for any genetic, the disease, either 1 millibrand or something? No. Oh, so can I ask that, how long are you in, this relationship? Okay, 4 years. It means it's a stable relationship. It means now you can offer, the genetic testing, because if they are serious, only in that scenario they are going to be going for this genetic testing. So if you have asked, then you can simply say that, okay. Then you can simply, if you have any idea, that what, if you remember at that time, the genetic pedigree, that, okay, that yes, it's a genetic condition, it's an autosomal recessive condition. So yeah, it can, so if you or your partner is having this, so the chances are that 50% of the, the babies can have this, or if you know, then it is okay. If not, then you can simply, say that there can be some chance that 1 in 4 baby can have this or can carry the gene, but cannot carry the diseased gene. Okay. And but geneticist is going to be in the better position to talk to you. So what I'm going to be doing is, after this consultation, I will refer you to the geneticist. So I will advise that you bring your partner along. Okay. So if you will go both together, so he will talk to you and he will, suggest you what exactly can be done. And coming back to you, that, the how are you going to manage? So Elizabeth, I very well appreciate that you are using condoms. So yes, unplanned pregnancy should not be there. So before that, I want to ask that, when you had your last, the checkup with your, the doctor, you use blood doctor. Well, it is okay. Sometimes, it looks very absurd. Blood doctor, bone doctor, kidney doctor, brain doctor. Hmm? Isn't it? So I would
Yeah.
suggest, thank you. I would suggest you can simply say that, we will talk to your specialist or we will talk to your hematologist. Okay, simply. If she doesn't understand what hematologist is, then you can say that, the blood disease specialists who are specialized in these, the blood diseases. Otherwise, I personally believe, because I have been through this exam twice, I have not seen any, the dumb, the patient, because I have had my, the all exams in London. So I have not seen any dumb, the kind of role player, trust me. So I would suggest that don't bring this bone, brain, kidney, heart, and blah, 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 doctor. Come on. Okay. So what do you call a gynecologist then? Uterus doctor? Or ovary doctor? What do you call then? Seriously, trust me, it for me, because I'm not of this school of thought that, I have to bring all these, the terminologies. However, if you are familiar or comfortable, it's okay. But it's a good idea that at least you say something, the good, and then if she doesn't understand, then, say something else. All right. So then you can say that I will refer you to the specialist. Okay. I will refer you to your specialist. And if he gives us a green signal that yes, you can get pregnant, then till then you have to, use your condoms. Okay. So there should not be any unplanned pregnancy, because the chances of, the having any, unwanted results can also be there. All right. So it's a good idea that, if we get a green signal from your doctor, until then you have to practice your condoms. Until then you have to start your, the folic acid as well. Okay. 5 milligram, 1 tablet a day. This is preconception, because she is in preconception clinic. So you have to speak something about preconception. You have to speak something about antenatal care. You have to speak 1 or 2 lines about intrapartum and then postpartum. If you remember the guideline, there are pretty nice points about intrapartum and postpartum care, if I'm not wrong, right? So I will come to that. So, sweetheart, the skin, you have mentioned about rubella injection or immunity. Let me tell you that it has been withdrawn from 2018. Okay. Earlier, there used to be a package, the NHS package of, the testing and immunization, hepatitis B, the HIV, syphilis, blood group, and blood typing, and this rubella. But since 2018, they have withdrawn this rubella. Now they assume that every woman in UK, NHS, and Ireland, they are immune to rubella. Okay, so you're not going to ask this. Okay, from now
Okay,
on.
so assume that they are immune already, they have received the
No,
vaccination.
so you don't even have to ask. Okay, you don't even have
Okay.
to offer. So
Uh-huh.
if at all you think that, this is a typical scenario, for example, if she has had history of any, the torch infection, the congenital anomalies, baby delivery, in the past. So in that scenario, you may touch this rubella. Otherwise, don't unnecessarily bring anything which can complicate you in your exam. Okay. So from now on, cut this part from your practice. Never practice, never ask this thing. Okay. Okay. So good points from your side. You asked about partner, you asked about his testing, very good. But you didn't mention geneticist, mention it. You used one word, that are you allergic to any drug or any medicine? See, sweetheart, for them, drug is drug. Drug is very fancy, okay? Marijuana, heroin, the ice, or any fancy, the drugs. That is drug. But medicine is medicine, okay? Are you with me? Okay, you got my point. So if you will ask about drugs or medicine, so they will consider drug as a drug and they will consider medicine as a medicine. All right. So for the drugs, how you have to ask, what I personally, the counsel or use for myself as well. Simply, you can simply say that, Elizabeth, do you smoke, drink alcohol, or do any recreational drug in one go? This is my, the kind of, the saying at all times. And this is what I teach to my own, the students as well. So I think it's cool. It's good. So if answer is yes at any point, for example, yes, doctor, I smoke. So you will stop and ask the number of smoke, the cigarettes. If the cigarettes are 1 or 2, don't send them to stop smoking cessation services with this, the heavy and lengthy lines. Okay. But if they are 10, half a pack, 20, full pack, 2 packs, then yes, she needs help. In that scenario, you will send. Likewise for the alcohol as well, likewise for the drugs as well, if at all they are involved. Why you ran, the out of a couple of important points, because you asked family history twice. When you open your station, you directly asked that has anybody in your family has had this similar condition. Then in the end, in the middle, you have asked again that anybody else in your family has this, the similar, the condition. Or then you have mentioned partner testing twice or thrice again. So this way you have lost your time. Okay. So if you will limit your, the use of all these things, if you will go systematically, so I'm afraid you're not going to lose anything. Okay. So then in terms of, okay, let me cut it short and let me tell you what exactly is going to be the model, the history taking in this scenario. You will simply ask that, okay, if she knows the type of this 1 millibrand 2, okay, it's good. Then you assumed yourself that she is on desmopressin. Not every 1 millibrand will be on desmopressin, sweetheart. Okay, until and unless they do have very low factor, less than 0.005, the 1 millibrand and factor 8. Only in that scenario, they will be on desmopressin or factors. Okay, otherwise, not every woman is going to be on. So, take home message, don't assume anything, ask. So if you have asked earlier that, are you on any, the long-term medication? Are you on any other, the follow-up with your GP for any medical, the condition or something? No. Have you had any operation on your tummy or down below? No, doctor. Okay. Are you allergic to any medication? No, doctor. Okay. And she's 26. So have you been offered your pap smear testing? Yes, doctor. Have you had that? Yes. Okay, brilliant. Was it normal? Yes. Okay, brilliant. Okay. So then you have asked about partner, then you will simply, now you will ask that, okay, Elizabeth, in the recent, the few months or years, have you had repeated attacks of bleeding? How about your cycle? Is it regular? Okay, is it heavy? How, how long is it normally? Because if they are having, the problem, so yeah, their cycle is going to be prolonged, isn't it? Their cycle is going to be, the heavy as well, isn't it? So you will ask at least, because for this, it's important. Then you will, the ask simply that, do you ever bleed on your minor injuries? Okay, on the small cut. So if that happens, so do you use anything? Yes, doctor, I do use tranexamic acid. Brilliant. That is a, the treatment option for the such situations. All right. Then you will ask, okay, done. All right. This is what you need for this. No need to go here and there. No need to inquire about so many other things. Then you will say, thank you so much, Elizabeth, for giving me this information. Now let me come back to your management. So your major concern was, how are you going to be managed and what are the chances for your baby? For chances of your baby, like I said, that you and your partner are going to be, sent to the geneticist, then, he is going to be in good position to talk to you about that. But yes, chances are there if your partner turns out to be the carrier or diseased as well. If he is not having any disease, then yes, chances are going to be very less that your baby can carry a defective gene or a faulty gene. Okay. Then, like for the till we get the green signal or till we get the the clear signal from your consultant, then you can only plan for the pregnancy. Till then, you have to take folic acid 5 milligram, once tablet a day, and you have to use your condoms as well. And if everything goes fine, then you can plan to have a pregnancy. Once you become pregnant, you will immediately come to us and you will booked in the consultant-led care unit. Then your pregnancy is going to be with the help of group of doctors, joint care. We will involve our specialist who have the special interest in blood diseases, your specialist as well, specialist nurse. And in the later half of pregnancy, we will involve, the baby doctor as well as anesthesia doctor as well. All right. And many a times, the women having this 1 millibrand type 2, type 1, they can have a, the very good pregnancy and a very healthy baby as well. So, they're not going to be having a major, the complication. However, there can always be chance that you can have, there's some problem with the bleeding. So we will be very careful. We will be watchful that, if at all you have any kind of complaint of bleeding, we will immediately evaluate it. Because in pregnancy, in all trimester, we have to have at least your, the 1 millibrand factor into the desired level, which is 0.05. In terms of the risk, so there can be risk to your baby, and the overall pregnancy as well. And there can be how pregnancy can change its behavior in the 1 millibrand, and how it is going to be for the baby as well. So there can be increased risk of the bleeding during pregnancy and during delivery. You may need some blood transfusion as well for the baby. Like I said, that it runs in the family, so there can be risk. Okay, and your antenatal care is going to be with the group of doctors, and then we are going to be having a couple of the testing, and it will depend on the number of this 1 millibrand factor as well. Then you will have the regular checks like any other woman in the NHS. By the time you reach 36 weeks of pregnancy, you will have an opinion with the consultant. You will have opinion with the anesthetist. They are going to be talking about when and how you are going to deliver and what are going to be the pain relief during pregnancy, because we cannot give any injection in your the muscles, okay, and we cannot give any the pain relief like epidural or spinal at the time of the delivery as well, because the chances of the bleeding can be high. So what options we can offer you at that time? There can be air and gas, okay, or there can be any IV injections. All right. And if everything goes fine, then you can go to have a vaginal delivery, but you will be delivered in the consultant-led unit. We will avoid, another patient safety, avoid instrumental delivery, any invasive procedure, okay, because there can be chances of having heavy bleeding as well. So what you will do is that you will be cannulated at that time, okay, and the blood will be sent for the cross match. We will need to avoid any injection in your back to numb the lower body as well. After delivery, your baby will be handed over to the baby doctor. They will test the baby with the heel prick test, and that is pretty safe, okay, and this we do offer to almost all babies, to the mother who are having any the genetic problem. So the baby is going to be having the heel prick test, and then we will monitor you for upcoming days, 3 days. You may have the chance of heavy bleeding. According to the guideline, chances of heavy lochia is there. So we will advise you to continue 14 days tranexamic acid. Okay? This way, your bleeding is going to be less. All right. Yes, you can breastfeed your baby, and after everything is fine, you can go home, and that's it. This is how you are going to manage. Am I clear? Any question, Elizabeth? Yes. Okay. It may look the long now because I have been explaining and everything, but once you will do on the same lines, so I'm sure it will be done within 10 minutes, because this is my exam case as well. So yes, it was pretty doable for me, and I'm sure it will be doable for you as well. The skin, am I clear? Any question?
Yes, ma'am, you're clear. Yeah, thank you.
Very good, very good. So for the good part for you is that I think like I said earlier, your tone, your pace, your the that is very beautiful, in fact. Okay, very impressive. So you just need to work on, I think, little bit practice. Okay, plus revise your the syllabus as well. All right, revise your 1 millibrand the bleeding this guideline. This is going to be important. All right.
Yes,
So
yeah,
you will
thank you.
never forget, because safety points here is no IM injections, no invasive procedure to the baby, no scalp electrodes, no fetal blood sampling, although we don't do it anymore, but yeah. So baby will be given vitamin K injection, heel prick test, tranexamic acid for 7 to 14 days. These are all safety checks, okay? If you will fail to do all these safety, plus geneticist, plus partner testing, these are all safety checks. So if you will not do all these safety checks, you will lose the station. Doesn't matter, how beautiful you speak and how you calm down the patient and how you answer, blah, blah, blah. But if you are not fulfilling the requirements, the chances are that you will lose the station. Okay? Brilliant, brilliant, brilliant. Good job. Any question, guys? Dipti, Naila, Adila? Any question? No? Very good. Okay, very good. All right. Brilliant. Okay, any the comment on the presentation? Clear, everyone?
It was a
Iman?
really nice presentation. It was really nice presentation by
Okay.
Dr. Zaib. And
Okay.
you also elaborated very well. That's really these are the key points that we should not forget. That might
Yes.
have been as a key points in keys as well. So
Yes.
they
Okay.
are on.
Very good, very good. So try to rehearse. Okay, try to rehearse all these points. Try to rehearse this station because this is a very hot station of exam. Trust me. I have had it back in 2018, and since then I think it keeps coming. Okay, and now we do have so many centers. We do have there's so many the examiners around. So I will advise that at least hot stations should be on your tips. There should not be any the ambiguity. How are you going to manage? And it should be very the clear. Okay, so very good. Who wants to the perform next station? Anyone?
Yes, ma'am.
Okay, Taiba, do you want to do? All right, let me open the slide for you, sweetheart, and then we will do it. I would like you to do a structured discussion with me. All right. So this way, I will try to give you guys the important tips in structured discussion, as well as we have done one simulated patient task, and now we will do one the structured discussion task. Okay, Taiba, clear?
Okay, ma'am. Okay.
Okay, okay, okay. So let me show you. Let me start the timer for you as well, sweetheart. All right, take your 2 minutes time, and then we will start. Yes.
Hi, I'm Deba, one of the exam candidates. I have read the instructions and I'm ready for structured discussion.
All right. So with regard to this particular scenario, you have to be answering in the lines of evidence-based management guidelines, and you cannot go back to previous question if you have answered one. All right. Okay.
Yes.
My first question to you is, how do you diagnose intrahepatic cholestasis of pregnancy?
Here is actually the case of a primary gravida with at 36 weeks to be diagnosed as intrahepatic cholestasis. She was presented as a complaint itching on the whole of the body, along with especially on the palms and stores, and intense, which becomes intense at night. And her biochemistry examination shows the bile esters and transaminases levels are raised. This is the typical presentation of the patient. Along with that, it is diagnosed on the it is diagnosed on the level of the bile esters, which are usually raised. But before that, we need to ask a few questions from the patient, like for the detailed history of the patient regarding itching and what severity she is having. Does it affecting her quality of life? Any rash on the body are there? And what is the location of the rash? And also, I need to ask her how her pregnancy is going so far, when this itching started on, and and how was its course going on, and how are the baby's movements. Does the baby was growing well? I need to correlate with her dating scan and on her pregnancy scan, and also need to rule out her blood pressure history, whether it is she's having or not during the pregnancy, how are her blood pressure controls, and her family history of concern, and along with that medical and surgical history that needed to be rolled out to help in further management of the patient.
Mhm.
And then I need to know about smoking and alcohol and any drug allergy, the drug intake history. And along with that, I need to know specifically about the contraception choices, if she has been on in the past, whether she was having combined hormone contraceptive, and if she was using, does similar complaint was having with them or not. And then I need to ask about her blood group and reservation for blood transfusion, as we are going to plan her pregnancy soon. And her mental health condition, that is also important, and her socioeconomic status, what does she do for living, and how well she is supported. After this, I need to examine the patient to look for the rash, and also the site of the rash, that is there or not, and especially the extensive surfaces of the legs, and after that, one need to examine the patient in the presence of chaperone for the fundal height of the baby, and presentation of the baby, and amount of lighter volume, and fetal heart sound as well.
Mhm.
And in
Alright.
this way, raise for bilaces and typical history of the patient, that is going to help with the
Mhm. Okay. So what are the
uh,
types of ICP?
Intrahepatic cholestatic of pregnancy is categorized on the basis of the bile esters level into mild, moderate, and severe form. When the bile esters is between 19 to 39, then it is called as mild. And when the bile ester is between 40 to 99, then it is moderate. If it is more than 99, then it is severe. It is also categorized, the moderate form can also be categorized as severe if it has, along with that, of some other comorbid condition like diabetes, hypertension, and any other medical condition the patient is having. And this bilis is all also going to guide us towards the delivery plan.
Okay. My next question is, how do you manage the case of ICP?
First of all, after introduction and taking the complete history and examination part, we need to debrief the patient regarding intrahepatic cholestasis of the pregnancy. And after debriefing to the patient what is expected in this, she should be careful regarding her fetal movements. And we are going to, there is a medical management in which we are going to do some pressure, some general measures in which we are going to provide to the patient with the help of ammonias for symptomatic relief, along with the antihistamines to help her sleep at night. And also we need to categorize the patient for intrahepatic cholestasis, and there is also tablet, also choledioxide. It is not recommended by RCOG. It is not of much benefit. However, we can give to the patient for this purpose as well. And then we need to plan the delivery depending upon the bile acids level. What are the bile? If it is more mild, then we can deliver the baby up till 38 to 39 weeks. And then it is moderate level, then we are going to deliver around 36, 30. If it is severe, then we can deliver it by 39, and if it is moderate, then it is at 38. And if it is a severe form, then we need to plan the delivery by 36 to 37 weeks. Baby should be delivered, as delaying the pregnancy can cause stillbirth, which we are not aware of sometimes. And we are going to counsel the patient during the labor process. The delivery can be, the delivery plan would be discussed with the patient, whether it is an induction or it is suitable, or it is a cesarean section. For cesarean section, the patient obstetric history we are also important, but this is a primary gravida, so we are going to discuss with the patient regarding her choices, if suitable for both. It is early induction or it is elective cesarean section, whatever the circumstances are there. And during labor, we are going to induce during the labor, that would be in a consultant-led unit, along with that of the adequate epidural to the patient, that pain relief would be given to the patient adequately. And during the induction process, the patient would be monitored through one-to-one care, and continuous electronic fetal monitoring is although recommended, that it does not have specific roles, but it does not depict the demise, but we have to do it for continuous electronic fetal monitoring throughout the labor. And if any concerns arise, that would be discussed with the patient. And then the delivery of the patient would be an active management of the third stage of the labor would be done, as these patients are at increased risk of hemorrhage. And after the delivery and active management of the third stage of the labor, patient would be shifted into the postnatal ward. And in the postnatal ward, she would be advised to check for Mew's chart, in which bleeding and her blood pressure would be monitored and pulse would be monitored, and her symptoms would be her need for thromboprophylaxis would be assessed. And after the delivery, she would be discharged if patient on the third day, and on 6 weeks, her LFT is needed to be. She would be discharged with the advice of contraception. She should not use estrogen-containing OCPs, and at 6 weeks, her LFT is needed to be repeated. If they are still deranged, then we are going to refer to her to medical specialist if they are settled. So we can offer her the suitable contraception method, that is progesterone only pill at the time of. And we are also going to reassure the patient that it does not affect the breastfeeding. She can breastfeed her baby as well.
All right. And the monitoring you have, they mentioned yourself. So anything else you would like to add? We still have got time.
How should we? No, nothing. It is important to write down in patient notes regarding her history of obstetric, and I would mention the patient that obstetric cholestasis can recur.
Okay. So time is up. All right. So how was it, Reba?
Ma'am, I think it was okay.
Okay. Okay. So again, in the structure discussion, very tricky, but very easy as well at the same time, keeping in view that if you understand the question properly. My question was, how do you diagnose intrahepatic cholestasis of pregnancy? You took me through the complete history. What do you take history? Examination, ultrasound, blah, blah, blah. So is that how do you diagnose intrahepatic cholestasis?
In the history, she was having typically the symptoms. It is already there.
So she was already made a diagnosis. Now consultant wants to
Yeah.
discuss with you. So it has already been diagnosed. Who is asking you that, how are you going to manage how do you take the history and how do you go about it? No.
Okay.
Okay, so you will say that, okay, since the diagnosis has already, okay, so how do you, the execute the station? Again, you will say that, okay, I'm Dr. Taiba, one of the exam candidate, and I am here for the structured, I have read the scenario and I'm ready for the structured discussion. Okay, fine. So, okay, so once any examiner asks you a question, so try to take a pause of few seconds and try to show that, okay, you are trying to thought processing. Okay, so what you will do that, okay, how do you diagnose? See, if you will just fix your own agenda in every question that you have to do this, the same what you have done, family history, personal history, blah blah blah, then you will examine blood pressure, then you will ultrasound. This is not how you diagnose. You will simply say that, the intrahepatic cholestasis of pregnancy is the clinical and the laboratory diagnosis, and is the diagnosed on the basis of this. In the clinical scenario, we do have this complaint. In the laboratory diagnosis, we will find this, like in this case as well, that she has had a raised bile acid and raised transaminases level along with this itching. So this diagnosis has been made. Simple. Taiba, are you there?
Okay.
Then my
Okay.
question was, what are the
Yeah.
types of
Yeah.
ICP? Yes, it was good. Okay. So if we say that, what are the types of ICP, then yes, mild, moderate, severe. Simple. Stop. Khalas. No need to go here and there. Okay. No need to add anything. You have just been asked the types of ICP. So just limit yourself to the types of ICP. Then how should the woman be monitored? This was our next, the question. So you can simply say that, the patient will be managed in the consultant-led care unit, and we will consider the repeating liver function test and bile acids after 1 week of the diagnosis, and then we will determine the frequency on the individual basis. Then on the individual basis, that means that if the diagnosis has been made, the mild, moderate, or severe, then the frequency is determined by that. Okay, then you are simply going to bring this. All right, that if you have made a diagnosis of the mild, if you have made a diagnosis of the this mild, and then the moderate, and then severe, then only you are going to talk the so many things. Simply you can say that in terms of the you are going to diagnose like this. Okay, then you can simply say that this is how we are going to diagnose. Then you are going to say that at the same time we need to do the fetal ultrasound and the CTG, and because usually it's not going to predict or prevent the stillbirth in the ICP. However, it is going to give us a clue, and we will ask the patient to have a fetal movement check as well. Plus, you will say that, okay, after this, the treatment option. You will simply say that, although RCOG does not recommend any particular treatment, and we are going to counsel the patient for that the no treatment will improve the pregnancy outcome, like the raised bile acids concentration or something, and treatment to improve the maternal itching will have a limited benefit. However, we can offer the patient a specific management and the symptomatic management. In terms of symptomatic management, we can offer her emollients, the aqueous creams with or without menthol, which will limit or which will, they decrease the itching. We can consider antihistamine agents such as chlorpheniramine, particularly at night, although the effectiveness of the treatments is uncertain. And then we can offer her the ursodeoxycholic acid. However, it will not reduce the adverse pregnancy outcome like stillbirth, like the antepartum IUGR or anything. So it's not going to the limit, or so we are not going to offer the other the agents, such as there are multiple other agents as well. We may consider vitamin K treatment if there appears to reduce the absorption of the dietary fats, or if there is any abnormal PT, APTT. Okay, this you can add. All right. Then the patient will be, given usual postnatal care, and patient will be offered a follow-up plan after ICP, that she should have at least, the 4 weeks, the follow-up after birth to confirm the resolution of the ICP. Then we are going to offer her contraception as well, but not combined hormonal contraceptive. But she can be offered non-hormonal contraceptives, or she can be offered local Mirena as well. In terms of ICP and the future pregnancies, The chances of recurrence is high, but there is no exact magnitude because guidelines said that exact magnitude is unclear. However, once the patient gets pregnant in the future, we will perform baseline liver function test and the bile acid concentration to just have an idea about it. So this is how the patient is going to be managed. Simple. Okay, so for structured discussion, sweetheart, because we are loaded with information, because all of us have read, all these guidelines and TOG articles, but again, the reason remains same. How do you execute this station? Because if you will talk in the diagnosis, you will talk about the usual history. What do you take in the simulated patient task, family history, allergy history, blood transfusion history, Jehovah Witness history? Trust me, you are just losing your time. Although there is no negative marking, but the thing is you are losing your time. Okay. So perhaps you may take, a lot of time and you may not reach to the next questions. So do try to understand that many at times these days, the RCOG is bringing, the huge scenario, and then the examiner is going to ask you, summarize this case for me and take me through the management. And then he will be quiet for rest of the station. So only you have to speak. So now this is your, the ability. How are you going to do that? You are going to summarize the case and then you are going to manage. Management doesn't mean directly, the injections, directly medicine or something. Management is going to be from history, investigation, then later on. Not in this case, but I'm giving you the general template. History, investigation, and then of course examination. Before investigation, examination, then investigation, then management. Then if it is management, then yes, conservative management if applicable, then medical management, then surgical management if applicable. So do try to, the manage like this. It has to be very, the organized. That's why it is termed as structured. It's not like, the juggling through your, the words, or, the just, the coming back and forth, just coming again from the history to the management, then management to the history. So there should not be any juggling. Okay? Taiba, are you there?
Okay.
You got my
Yeah,
point?
ma'am, I'm listening.
Okay.
Yes.
Okay. So in the last, the few weeks, what you need to do is you have to practice. I know, I'm sure you must be practicing, but again, if you will practice like, we have discussed now, analyze yourself that whether it's a good idea, whether it's a good deal, that if you try to perform your stations like this, is it going to bring any change? I'm sure it is going to bring. Okay. So do try to, the rehearse, do try to understand the question. Don't go here and there. No examiner is interested in your story. No examiner is interested whether you have read your 80 pages guideline. I just need diagnosis. So please give me the diagnosis. I just need investigation. So just talk about investigations. Even if you are talking to me, with your, the 2-3 pages history template and all, okay, no problem. I'm not going to stop you. But yes, you are losing your time. So it means you're losing your next set of questions, okay? And eventually you will lose your station as well because you will not reach. But by the time you will finish your station, you will come outside and inside you will be so happy that, oh, no, I have done this station because I have said that, I have said that, I have said that. Maybe yes, maybe no. Many times what happens is that examiner do consider your, the, what you can say, that inorganized talk. Okay, many times they don't like it. So again, because I always say this is your exam. So you have to tailor your preparation according to the exam perspective. Okay, not to what I like or what I prefer. Because I'm sure by now, everyone is very much familiar with the exam pattern and everything. Okay. So do try to, think out of the box and just think that what will happen if I will talk like this. All right? Okay.
Thank you, ma'am.
Brilliant.
Thank you.
Brilliant. Thank you so much. Any question, guys? Dipti, Taskeen, Asfa, Bushra, Deepa, how are you? Manikam, Asifa?
Fine, ma'am.
Very good. Any question, guys? So let me conclude again the session that how are you going to do, what are you going to do in the last, the 14 days? Just rehearse, practice properly, okay? Find out that what are the, the hot topics. For example, the any guideline which has recently been revised, there are a high chance that guideline can come in exam, either in the form of simulated patient task or structured discussion task. Okay. And always remember that it is your exam, so you need to be prepared. Okay, because there are hundreds and hundreds of templates around, but it does not mean that all those hundreds and hundreds templates are necessary for you to read. Okay, so all you need to do is try to get a hold on, the salient points of every module, and then just try to go through. Even if you don't know about the topic, doesn't matter. You know that how are you going to go about that particular module. All right. So in case if you want to book, the any mock with me, because I have 2 or 3 slots left. So you guys are encouraged, and I will invite all of you, anyone who wants to book any mock with me in the upcoming, because in the next week, I think I have 1 slot, and then close to exam 2 slots. Okay. So if anybody is interested, or I think Bushra has approached to me, and one more girl, I don't remember her name. I think Bushra, because team has given me your name, right? So if the any free candidate doesn't show up, I will send you a message. Okay. So inshallah, I will see you guys maybe some other time, or I will try to arrange another session just right close to exam. So perhaps it will be helpful to all of you. All right. So the take home message should be: read question carefully. Just perform according to what exactly has been asked. Don't make stories in your head. Don't fix your agenda. Listen to the patient, and then just the go through. I'm sure it will be a piece of cake then. All right. So all the best, everyone.
Thank
Take
you.
good care of yourself.
Thank you.
Okay. Travel with your convenience. Okay. And do try to just, the focus, stay focused. Okay. So, do try to take care of yourself as well. And that's it. This is what, this exam needs. Don't put unnecessary, the burden on you, be it physical, mental, or financial. Okay. All the best, everyone. All the best. Bye-bye. Thank you so much for your time, everyone.
Bye. Thank you.
Thank you.
Thank
Thank you so
you.
much. Thank you so much, sweetheart. Thank you.